The theme of the first breakout session is health in academia. So it is our great pleasure to introduce Dr. Lourdes Baezconde-Garbanati. She is a full tenured professor at the Keck School of Medicine at USC and director of the Center for Health Equity in the Americas and co-director of the Global Health Tract in the MPH Program. Her work focuses on community-based research and public health initiatives that explore the role of culture in health behaviors, especially for Latino Americanos and Latino populations in Latin America. She teaches courses on gender and ethnic minority health, culture, and on community organizing and mobilization for health locally and globally. Her research focuses on providing an evidence base for best practices to modify cultural and lifestyle risk factors for cancer and tobacco control at the community level. Great, and can we have a round of applause for Dr. Baezconde-Garbanati?
Thank you. And one of the best things was that she could pronounce all that. Good morning, buenos días. Buenos días, ay, qué bien, that's good. Well, I'm really delighted to be here, although I do come from the other side. At USC, I actually graduated from UCLA, both in my MPH and in my PhD, so it's really wonderful to be somewhat back home. Today I wanted to talk to you about a project that I worked on with in a very transdisciplinary fashion with the Annenberg School of Communication and the School of Cinema, as well as the Art Center College of Design. And we also had a very large group of promotoras de salud that were engaged in the project, and we had community health workers both here locally in California as well as in Panama. So I'm going to talk a little bit about this. I want to recognize the several co-authors, including Dr. Sheila Murphy, who is pretty much the kind of my partner in crime with all of this kind of stuff. This program about narrative actually was funded through what is called a TRO1. RO1 are research grants by NIH, and the T ones are the transformative ones. Those kinds of awards are usually awarded to basic scientists. So there's been like 40 awarded over the life of the entire mechanism, and only four in the life of the mechanism have been awarded to behavioral scientists, and we were lucky enough to get one of these. And the whole premise of it was that we would do very innovative research that would help advance the field some way. So that's what I'm presenting today. I'm going to discuss a little bit about cervical cancer worldwide, present the problem of HPV infection in both Latin America, the US, and Panama. Then I'm going to talk to you a little bit about our film, and I'm going to show you our film as well, and discuss our transdisciplinary research, both US and in Panama, and some of our future priorities. So why are we even interested in focusing on cervical cancer, which is really the topic, and the HPV infection of a lot of this work that we did on this transformative RO1? Cervical cancer is the fourth most common female cancer worldwide. There are more than 500,000 cases diagnosed each year, and 85% of those deaths occur in the less developed nations. There's a high incidence in mortality, especially in the United States among Hispanic women, where 3.4 deaths per 100,000 are happening among Hispanic women compared to non-Hispanic women. In the United States, the human papilloma virus infection is rampant. About 80 million, or 1 out of every 4 Americans, are currently infected with the HPV virus. So the cervical cancer situation in Latin America and the Caribbean is that it kills more women than any other type of cancer. And screening and treatment with the Pap test is challenging and costly. But we do anticipate that with a 70% coverage over a 10-year period in Latin America and the Caribbean region, we could really make a big difference in terms of this disease. Historically, in Panama, there's a high incidence rate of up to 79% of cervical cancer, and it currently ranks second in terms of incidence and mortality. So there's a major global impact of HPV vaccination. We could really make a difference. As the speaker before me was saying, in terms of the eradication of polio, it is my desire that in my lifetime we could eradicate cervical cancer. And I think that having a vaccine puts us already on the way to do so. So the HPV vaccination, unfortunately, in the United States has stalled, and it's not likely to occur without a real comprehensive and targeted types of interventions. In Los Angeles, for example, only 29% of girls have had the 3 shots of the vaccination, compared to 57% nationally. And when we talk about boys who can also transmit the disease, it's really only about 5% in Los Angeles compared to 35% in the rest of the country. And without vaccination of both boys and girls, the virus will never be fully contained. So it's really critical to also have this message for boys and girls. HPV vaccine in Panama. In 2008, Panama became the first country in Latin America to offer the HPV vaccine free as part of an initial program to vaccinate girls 10 years and older. And between 2009 and 2013, you could see already the major difference in terms of the vaccination rates, coming from 46% to 80%. So you know that somebody's making a difference, and there's a way that they're doing it. I want to stress the importance of the HPV vaccination. Just recently, on January 27th this year, the 69 cancer centers, these are all cancer centers around the country in the United States, along with the NCI, put out a consensus agreement in which they all pretty much agreed to move forward on HPV vaccination in order to make cervical cancer what we call a disease of the past. So there's a very, very large effort. We anticipate that there's going to be large funding for this as well, because it's become one of the National Cancer Institute's main priorities. So what is our research? Our research was to conduct a clinical trial to test the relative effectiveness of the identical information presented in a narrative and in a non-narrative format. So why were we doing that? Just like in a clinical trial, you need to know that a drug works before you actually use it. So in order to transform the way that we actually educate and provide health education worldwide, we needed to test that one way was better than the other. So narrative is really all about storytelling. It's about talking about people's lives and really engaging in people's lives. The normal way that we provide education is in a non-narrative way, the way that it's done in most of your classes with bars, charts, talking heads. So that's the non-narrative way. Not that it's not effective, if not you wouldn't be here, but really in reality, for learning, we believe that you could learn so much better and so much effectively through storytelling. So we set out to do that. This is a picture of Dr. Sheila Murphy, and she and I co-produced along with Jeremy Kagan and Del Mayer at the USC Cinema School the film, and I'm going to show you one of the films at the end. So our methodology, we had a parent study, which included the non-narrative, It's Time, that's the one that is all with the charts and figures, and then the narrative Tamale lesson, which revolves around a family's preparation for their youngest daughter, quinceañera, it's her 15th birthday party. And here's the study design, where we had 900 women exposed to either the control condition or the experimental condition. We also tested it among European, African American, and Mexican women. And although the narrative was really produced for Mexican American women, we wanted to test the universality of the message to see if it would cut across other cultures as well, and if it would be well understood. And then we conducted a series of follow-ups at 2 weeks and also at 6 months post having viewed the film. There were several additions to the parent study. That's the parent study. We also collected data among Korean women. We received additional funding to just focus on Spanish-speaking women with low literacy, and that data is also pending. And then we conducted several pilot studies in Panama with Dr. Lisa Gantz, who's here, right there. Lisa, raise your hand. And I'm going to present some of that information today. So first of all, I want to tell you about the effectiveness of the narrative or tamale lesson versus the non-narrative film. And what you could see here is at the bottom of this, what you see are women who were not due for a pap test. That means that they were already in compliance. And so what you do see is that there is a disparity in terms of compliance, with the European American having a much higher level of compliance in getting their pap test than African American and Mexican Americans. But what you see then is that with the women who went to either one of the conditions, there was a difference in terms of them coming in for screening. And what we find here is that at the end of the 6-month period, women had either already had a pap test or gotten an appointment to do a pap test. So what we were able to do was, within a 6-month period, was actually correct a health disparity that existed in cervical cancer screening at baseline. That is really unusual, and it's pretty extraordinary, and the NCI has been all over these data. We've published 20 articles and have done hundreds of presentations on the topic and been asked to speak in so many different places, because now people want to really understand how do you use narrative to really educate the public about these issues. Among women who saw tamale lesson, and this is something that's really important, it was not ethnicity per se that predicted the impact, but the extent to which people were transported or immersed in the story and how they identified with the positive role models in the story. The reason why I have this slide in particular is because we're all innate storytellers. But we can't always produce stories that are going to make changes in behavior, even if they may increase knowledge, but what we're looking for are outcomes. And so how do you make a film or some kind of narrative that's going to make a difference? And in order to make a difference in outcome, these are the key theoretical variables that are important. The variable of being transported into the story and identifying with those characters. So our Panama study, and that's Lisa right there, oops, was conducted with over 300 women and focus groups with 47 women, which explored knowledge, attitudes, and beliefs. And we also evaluated the acceptability of an awareness of HPV infection and vaccination. And that's what I'm going to present today. And Dr. Lisa Gantz got this scholarship from the Dean's Research at USC that allowed her to spend an entire year in Panama conducting this part of the research. So this is the methods for the Panama study, and I want to point out the recruitment sites, which included very community-oriented sites, such as the Panamanian Association for Family Planning, and this was a National Cancer Association private health center, as well as 24 de Diciembre, which is one of the clinics of the Panamanian Ministry of Health. And we have been going back with our students to these clinics now for over 7 years in order to continue conducting research in Panama on these issues. So we had a study instrument. I'm not going to go into too much detail. And this tells you about the trek Lisa had to, and we've all done it because I've been there now, going 7 years that I've been there. So that's to get to the center. So doing the work in global health sometimes isn't easy, and there aren't always street addresses. They will tell you it's where the crank is, or where the tree that looks like this is, or the little store in the corner, and that's how you get to places. So it's not always easy to get there. Here are some of the reactions from the women in Panama who also saw it. And remember, this was made for Mexican women, but we're also testing its universality. I love it. I wish I could have a copy of it myself. It's like a telenovela. It grabs the attention of whoever, whether it's a child, a teenager, or an adult. You want to stay watching it and paying attention to the movie. So there is really the part about transformation. So I'm going to skip some of these because I've just been given the 15-minute mark, and I want to make sure that we have time to view the tamale lesson. So let me try to take us there.
Hey. Yeah, I've been trying to reach you. What? No, I'm not making this up. You gave me this disease. You know what? Yeah, don't bother calling me again. We're through.
¿Qué pasa? What's up?
Nothing.
Your boyfriend?
Or just too much salt. Huh? We know what we're doing.
Do you? Do you
What?
know what you're doing? You and your boyfriend?
You would understand.
Why not?
Because you're a prude. You always think you're so perfect and so good, and you will probably judge me.
Hi. Here it is. Oh, I can't believe you got this quinceañera dress for $100. The girl who was supposed to wear it got pregnant and can't fit into it. Rosita is gonna look beautiful in it. Ay, one mother's tragedy. Is now another mother's boutique special. These girls nowadays don't respect themselves and open up their legs for anyone. Not like in our day, when a man had to marry you to even look down there.
He's a jerk.
What did he do?
You're gonna tell Ma?
No, I'm not.
He gave me a disease. The HPV virus.
That's terrible. What is that?
You're that innocent?
No. I know stuff.
Okay, what's HPV?
Huntington Park.
No, it's the human papilloma virus. I have it in my crotch.
Ay, yuck. How did you get that?
How do you think, stupid? From sex. It can cause cervical cancer.
You have cancer?
No. I have a virus that can cause cervical cancer.
How did you find out?
Through a pap test. Well, lucky I found out now than later, right?
What are you gonna do about it?
I'm gonna get a pap test every year to make sure I don't develop any abnormal cells.
That sucks.
Have you ever had a pap test?
No, I told you I'm a virgin.
Okay, it's true. You mainly get HPV from sex. But so what? You're 21 and you should get yourself checked out anyway.
Checked out for what?
A pap test?
What's a pap test?
Nothing.
Nothing.
Hey, I gotta know things too. I'm about to be a woman.
You're about to be 15, not quite a woman.
Petra got married when she was 15.
And I was too young. Why don't you go try on your dress? Why are you going to have a pap test? Pap test? That's what they're talking about while they're making tamales. Can you believe this?
Well, every woman should know about pap tests.
Why are you perverting your sister? She doesn't need to know about those things.
Yes, she does. Do you want her to get cancer?
Who's talking about cancer?
You can get cancer down there.
Yes, but Connie's not like you. She's a virgin.
Pap tests are not just for women who have sex.
Ay,
Do you know women from 21 to 60, they should get checked at least every 2 years. And if you're sexually active, you should get checked more often. I heard 50% of the women have this virus.
That many?
Yes, and if you don't get checked, you can get cervical cancer and it can spread all over your body and you could die. You should get yourself checked, Petra.
My husband is dead. Why would I need a pap test?
Who has the time or the money?
It's not that expensive. It's an easy checkup. Plus, I hear women your age.
I ain't that old.
I'm just saying, you're on the higher risk. Plus, it's very easy. You don't even have to go to a hospital. You can go to the clinic on Central, and it's free.
Does it hurt?
No, not really. Just like a mosquito bite like this.
Ow.
It's embarrassing.
And it's probably uncomfortable.
No, it's more like this. Okay, when you go to the doctor, you sit on the table, and they spread your legs like this.
Stop. And what exactly does the doctor do?
Okay, so let's pretend this is your vagina.
It's not that color.
Petra, just pretend.
Okay, I'm a tamal.
So the doctor has like this device, this metal device. They just spread the walls of your vagina.
I don't say words like that.
Petra, you never had this test done before? It's not as bad as it looks. Mira, mira. They take this mascara type wand, and then they just swab you on the inside like that.
Yeah, they take a little sample of your cells.
What if you still have bleeding down there?
Ay, mija, are you still having that problem?
And that's all?
Yeah.
You find out right away if you have a problem?
No. Usually, I don't know, it takes like, What, you do the test, and then they send it to the lab, and you probably get the results like in a week or two.
Too much salt. Put in some sugar.
Hey, Petra, you should get checked.
At our age, I don't think we still need to. Besides, we're not having sex.
Speak for yourself.
You don't need to have sex to get cervical cancer.
Is that true?
Petra, you know, you could still get remarried.
Ay, no way, God forbid, ni Dios mande. My husband, may he rest in peace, que en paz descanse. He would not like that.
So everyone should get checked out.
Yeah, once you're 21, whether you're having sex or not.
It's not for me.
Yeah, me neither.
How's the tamales? Hey, what's up?
Nothing. Did you see the dress?
Oh, she looks beautiful. The cake is here. Where you want me to put it?
I'll show you where to put it.
I gotta go.
I'm gonna check out the banquet hall.
You know there's a vaccine that Rosita could take so she can prevent the HPV?
A shot for kids?
Mm-hmm. 3 of them, starting at 9 years old. If I would have had those shots when I was younger, I wouldn't be in this mess I'm in now.
It's been a while since I've had one of those tests.
Who has the time? Isn't that Doña Flora's son? See? She was such a good woman, always going to church, always helping everybody. Then out of nowhere, she gets sick, and God takes her with him.
Cancer. She left 3 little kids. The husband is having a hard time. He's really struggling. And the kids too.
Such a cute boy.
I guess a little pinch once a year is worth it if I get to watch my family grow up.
I'm not sure about this.
But you agreed.
Well, I'm changing my mind.
Oh, come on. I'm not going in there without you. No. Come on.
This is ridiculous. A woman my age coming here. I don't know why I let you talk me into this. Mejor me voy.
No, Petra, you're my best comadre. If something were to happen to you,
Pues para qué? I'm old. I've already lived my life. And if God wants to take me the same way he took my husband, who am I to get in the way?
like, Petra, you're only 55 years old. That's young. And God made doctors so that we could live healthy lives. And remember, you're not here just for you. You're here for your familia. Hi, this is Petra Martinez. I'm Blanca Oliver, and we're here for our pap test. Not so loud.
Okay, I have you down. Go ahead and have a seat, and we'll call you.
Connie?
What are you doing here?
Are you in trouble?
No, Mama. I just thought I should get checked out. And it's not so bad, but they can make that room a little warmer.
Mrs. Martinez? Mrs. Martinez?
It's no big deal.
Make sure to schedule an appointment in a couple of weeks to get your test results. You know we might be doing newer detection tests in the near future.
Okay, I'll see you then.
See ya.
He examined you?
He was very gentle.
Mrs. Martinez?
Are you gonna do it?
I'm not sure.
Petra Martinez?
Here, I'm right here.
You want me to wait?
Why don't you go get us something to eat, Mamita?
Tamales?
No. So?
Okay, I'm ready.
So one of the things that we wanted to kind of leave with you is that we don't quite understand why HPV uptake has been so slow. And that's really a research area that we think is really important to tackle, especially when we see that other countries in Latin America, like Panama, have been able to adopt policies related to that. We understand that there are some issues related to just vaccination in general in terms of attitudes about that, but there's also some issues related to patient and provider recommendations and follow-up on the 3-dose of the vaccine. Not everything is completely perfect, so there are issues. And so, for example, we know there are knowledge gaps. This is for the population in Panama, but we also understand we have knowledge gaps here in the US. And I'm not being able to move this forward. Let's see. Okay. So several educational materials were developed for Panama, and this is, some of these are being used to train community health educators in Panama at the moment. Okay, we don't want to end the show yet. Here's an educational toolkit that's been developed as a result of that. And I just want to tell you that we've done broad dissemination. There's a Promotoras conference that takes place in Los Angeles, and we are working with about 4,000 Promotoras de Salud to get the word out. We've also been in 8 different countries throughout Latin America, getting the word out with this, in addition to Panama. And Dr. Gantz published something even in the newspapers in Panama, in La Prensa, so it's not just what we're doing within the journals and things like that, but also more broad dissemination. And we've won multiple awards, including the National Institutes of Health 10-Year Common Fund Award for the best video produced in the 10 years of NIH, and that, in the last 10 years, so that was really big. Also, APHA has awarded the best multimedia video because there are multiple ways that you can access the information. Dr. Murphy received the Roger Everett Award, and Dr. Gantz also received another award from APHA. And I received an award from Buena Salud America, which is a conglomerate of about 22 countries in Latin America for this kind of research. So there's been a lot of popularity, and just to leave you with some of the future projects that some are ongoing and some that we're working with. This is with the Art Center College of Design, so we will be embarking in some of these projects. And I just wanted to mention before we go that we have one project that we're also working on right now, which is called Es Tiempo, and it uses an environmental cue, which is the blooming of the purple jacaranda tree that you see in Los Angeles between April and June. You all have seen that, right? As a reminder for women to either get vaccinated or to get their vaccinations or to come in for PAP screening. And I'm going to show you, just to tease you, and I know I'm almost out of time. This is this data, we got it 2 days ago. It's the data between our intervention clinic and our control clinic. And the intervention has an outdoor media, which is composed of bus benches, billboards, and those lampposts that you've seen, those lampposts, big billboards. It also has an in-clinic component made up of posters and postcards. And then the control clinic, of course, didn't receive anything. And what you see is there's a 13% difference, which is significant at the 0.001 level in terms of that, in terms of using the jacaranda as an environmental cue. And among 345 women who were completely out of compliance, they were lost to follow-up, and we sent them some of the clinic materials, and some of them had been coming into the clinic for other reasons, for their children rather than for themselves. 65% of women out of compliance came in. So we know we're doing something right by using and being very creative in the work that we're doing. As was mentioned earlier, both Dr. Gantz and I, we have founded a new Center for Health Equity in the Americas, which is at USC. And this is one way that we're thinking that we could really reach out to fund student research to really help us move this forward, because we think that students have, some of the brightest ideas and wonderful minds, and we're really looking for talent. So let us know if you want to form part of any of the research endeavors that we're engaged in, and that's pretty much it. I'm going to actually see, Lisa, do you want to add anything? No? Good? Okay. All right. Well, thank you very much, and I look forward to speaking with some of you later. Oh, here are copies. We have it also in Spanish.